Hey, I'm back with my good friend Dr. Tim Linker, and we're going to be talking about head trauma. A lot of people have suggested that I should have my head examined, but we're going to talk to you folks about when should you get your kids' heads examined. Head trauma, Doc, is it something that's pretty prevalent in sports?
Man, it is. I'll tell you, I'm fortunate enough to be the team doctor for Lebanon, and there's rarely a week that goes by, especially during football season, that we're not dealing with some kind of head injury issue. And it's kind of seasonal. You tend to, I mean, obviously, your collision sports, you're going to see more head injury. But man, kids fall down the driveway, kids wrecking their bikes. You know, kids will, or people will just kind of bang their heads. You know, they slip and fall in the shower, and they get kind of knocked silly. But yeah, in sports, the head injury management has become kind of a neat topic because we're learning more and more all the time.
Obviously, football's a sport where you have head trauma. Lot of kids out there now into skateboarding, rollerblading. Obviously, I'm sure you're probably an advocate of the helmets.
Yep.
What other sports are real prevalent for head trauma?
Soccer is one where, you know, obviously heading balls is not a natural phenomenon.
Yeah.
You know, but any of the collision sports, any contact or collision sports, hockey, certainly at that speed. I mean, the guys skate so fast. Soccer, football, rugby, lacrosse, anything where guys are knocking into each other, you see it. You know, obviously less so in baseball. You certainly see collisions at the plate, but your chances of getting knocked in the head playing baseball or playing tennis are certainly far less than, you know, playing hockey or playing football.
I remember back when I was a kid, about 500 years ago, I wouldn't naturally volunteer thanks to my parents. What should their parents look for?
So you're saying teenagers withhold information from their parents? I've never heard of such a thing.
Perhaps, yeah. So let's say a kid who wants to continue to play has a tough practice.
Yeah.
And the coach might not see it because they might miss a hard hit in practice. What should the parents look for as far as
That's a great question. That happens all the
symptoms?
time.
Yeah.
That happens all the time. You know, I didn't really have a problem in practice, but I went home tonight and I threw up.
Yeah.
Most kids will get headaches with concussion. Let me back up. Concussions come in all different shapes and sizes, and we kind of grade them on several things with several criteria. One is, did the kid get knocked out or not? You know, was he knocked silly in the field, and was he unconscious? Was he asleep when the doctor or the trainer got out there to see him, or was it the kind of thing where he took a big shot on a play, ran off the field, and then he was just kind of acting kind of funny? You know, those are both concussions. I mean, those are both just degrees of the same thing. There isn't a great test. I mean, there isn't a diagnostic test that we really use because CAT scans typically are normal.
Yeah.
You know, so most of our assessment is done clinically, meaning we talk to the kid, we examine the kid, and kind of make our decisions at that point. Symptoms can be wide-ranging, and that's what makes it tricky. Headache, visual changes, nausea, vomiting, confusion, difficulty sleeping. These are always tricky. It's difficulty sleeping, difficulty concentrating in class. You know, acutely, again, if I'm on the sidelines of a football game, it's kind of nice because we're there and we kind of see the play unfold and kind of see what happened. You can see if the kid is down. You can see how he's acting. When you and I were in high school, and we used to joke about, we used to call it the Riddell buzz, meaning the helmets, the brand is Riddell usually, and so kids would get hit hard. They'd run back to the wrong huddle, or they'd run back to the wrong sidelines, which we kind of laugh and say, "Hey, look at Johnny, he's running the wrong route."
Yeah.
And now what we know is those kids had traumatic brain injury and had no business getting hit in the head again.
Yeah.
The risk with concussions isn't so much the first one. The risk is the second one.
Yeah.
And that's what all doctors and all trainers are trying to figure out. When can you let a kid go back safely without just saying, well, you're done for the season.
Yeah.
You know, sorry, out of luck. You know, what's that point at which we can send a kid safely back into play? And I think we're getting more and more comfortable with making those decisions. There's not a hard and fast rule. We have some guidelines that have kind of come down from, you know, the neurologists and the sports medicine guys who have kind of, you know, studied these things. What we know is that kids who take a hard hit to the head, whether it's a hard, not even necessarily the head, any part of the body, where they either have a direct blow or even a rotational thing, a rotational motion, kids will have actually a traumatic brain injury. The brain doesn't get bruised. Like if you get hit in the arm, you actually have blood flow.
Yeah.
Your brain doesn't bruise like that, but there is kind of a cascade of chemical reactions that occur in our brain that is, you can actually do a PET scan and see them, which is a brain scan, which can actually see some changes. But what usually happens then is this whole kind of cascade of stuff starts. And the first thing we want to make sure of is, does the kid have something bleeding in his head? Does he have a hematoma in his, or a blood clot in his brain that we need to be concerned about right now?
Yeah.
Fortunately, the vast majority of the time, kids don't. Even a really hard shot where you get knocked out cold, very rarely do kids actually have any bleeding inside of their head. So once you've ruled out the dangerous stuff, then you kind of deal with, all right, now we've got a kid who's confused on the sideline, what do you do?
Yeah.
And we base our management on how long does the kid have symptoms, what symptoms does he have, was this the first concussion of the season, was this the second concussion of the season? All those factors play into our decisions on when we can let kids go back to play. The trainer, I work with a trainer at Lebanon High School, she's phenomenally good about recognizing these things and being conservative. I think what we've learned is, through all the research over the past couple decades, it pays dividends to be conservative with these kids. Again, I say we laughed about it in high school. Coaches would say, get back out there and be tough.
Yeah.
Don't be a baby. I know you're throwing up.
Yeah.
What we know and what our coaches here have been educated on very well is these kids have traumatic brain injury. They need to take some time off.
Yeah.
Because that second hit can be catastrophic, can be fatal sometimes. So we need to really have a low threshold. And that is, again, confusion, anything weird, anything out of the ordinary. I would err on the conservative side and keep the kids out.
Yeah. So I think with parents making sure that if they're doing recreational sports like skating, bicycling, definitely wear their helmets.
Absolutely. Man, you're not going to find a bigger proponent of helmets than kids. In fact, my son last year as a 6-year-old fortunately was wearing his helmet, and he was just riding his bike on our street, took a tumble, hit his head, already actually broke his helmet. You cringe to think what would have happened to the kid had he not had the helmet on.
Man.
I see it all the time. I mean, I've got a couple helmets in my office that people have fallen and broken their helmets because they've hit so hard on the pavement to actually crack their helmet. Yeah, no question. I mean, you basically go from having road rash and getting kind of banged up to having a catastrophic, life-altering injury just by hitting some gravel wrong, or it's just crazy. I mean, the helmets are just great.
You mentioned that, the athletic trainer, Kathy, and I just want to express how fortunate we are to have trainers of that caliber available for sports. I remember back when I was a kid, we had a team manager, and I appreciate what they did. They'd bring us water, ice, salt tablets in the summer. That was it. We didn't have someone who understood mechanism of injury. I watched her stabilize someone's neck when they had a fall, and just the precision and the quickness and how she acted, and getting the EMT people out there.
Oh, she's a pit bull.
She's incredible.
And I've worked with, in my relatively brief career in sports medicine, I've had the pleasure of working with a bunch of different trainers. Lebanon is blessed. I mean, there are a lot of good trainers around. I'm more familiar with her, but they're very fortunate. She is extremely well trained. I mean, athletic trainers, like you said, they're not team managers. These guys have, she's got a master's. These are 5 and 6 years of training to do this stuff. Many thousands of hours of experience. They also have the advantage of knowing the kids, knowing the parents, and developing that relationship. And that's pretty important too. If you're going to take the starting linebacker out of the game during the championship game, you better have a good relationship with the coach and with the parents, because otherwise you're the town villain at that point.
And making that right decision at that right time is so critical.
And she's sharp. She errs on the safe side. I mean, she ultimately knows what I do, that football is important. Protecting these kids from themselves sometimes is more important. Now we're real fortunate here.
Well, head trauma is critical. If your child is acting kind of goofy, if they're sharing with you that they had some trauma, don't second guess it. Don't blow it off. If things worsen, it could be catastrophic. So make sure you follow up and get some assessment. Call your medical doc. Maybe even the emergency room if the symptoms are getting really bad. If you need to see Doc Linker, you can reach him at
513-701-5510.
Heads Up on Head Trauma.